lessen. But you have jaundice that happens, that is present at the birth, and jaundice that develops after the birth are two totally different things. If I see a baby that's jaundice at the birth, I'm concerned about this baby. I'm looking for them. I'm doing more deductive observation, listening, and checking responsiveness. Talking to the mother about things to look for, especially if I feel comfortable enough to leave. Most often, I haven't seen a jaundice baby born jaundice. I just haven't in my practice, and but that is problematic if you do see it. I do see jaundice that develops later in the pregnancy. After the birth, and I would say probably 30% of my clients experience some range of jaundice. And so what I normally see is a little yellowing to the eyeballs most often. And I have noticed in African American babies especially, the pediatricians say, oh, that's not jaundice, because the eyes are a little colored. I've had that happen a couple of times. And I'm like, this looks really colored to me, but after further investigation, it's not jaundice. So just heads up for that, possibility. If I see jaundice, I'm advising my family about sunlight and breastfeeding. Babies need to eat a lot so they can pass stool, and they need to be exposed to the sun so they can break up that bilirubin in their bodies. The key with jaundice is digestion, making sure baby is eating and passing stool. That's how you really get rid of that bilirubin in the system. Skin marks like birthmarks, stork bites, Mongolian spots. I've seen all different variations of that. Mongolian spots are very, very common I'm seeing lately. And especially down the sacral spine, and also even on, I have noticed in my practice, and almost like irradiating from the chakra points out through the back. So I'll see like these Mongolian spots down the back of the baby, and then a large one across the sacrum. Most often, if I see Mongolian spots or those dark pigments on the baby, I'm seeing it down the back like that and across the sacrum.
Like I'm confused. Like I guess I know what a birthmark is.
A Mongolian spot is just like a pigment deposit. You see it most often in ethnic babies. African American babies, very common with, and it's like as if the pigment that was for your whole body got concentrated in one area.
Okay.
So you'll have like a darker mark. Usually it's brown. Sometimes it can be bluish brown. Most often I see it on the sacral.
I feel like I don't know. Like, I have a birthmark, and it's like, this is my skin color, but it's like a little bit darker in that area. That's a Mongolian spot. What is a birthmark?
Well, well, usually Mongolian spots will fade over time.
Okay.
So with like my brother, my middle brother, he had like a blue butt. So his little person friend, and he would be like, oh, you got a blue booty. And we're like the kids that ran around naked in our yard. Yeah. That was a topic of conversation a lot. But he doesn't have a blue butt anymore. He's an adult now, and he doesn't have it anymore. So if that was a birthmark, it would have stayed through your life. With a Mongolian spot, they definitely.
I have a couple. Like I have one on the side over here, and then I have one back here. Actually, it's like right above the crack of my butt.
Okay.
And so.
Is it localized or is it pretty large?
No, the one up here is kind of bigger, but this one is it's not large at all.
Yeah, that's probably a birthmark, the smaller one.
Yeah.
Usually with the Mongolian spot, you'll see it disperse over a broader amount of a broader
My
area.
niece, she has, and she's a mixed baby, and she has, it's kind of funny, because she has like, it's like a raspberry right here, and when she gets mad, it like just turns red. It turns red. I'm like, like, and it's still there. I mean, she's a year and a half now, and I mean, it's still there. Like, when she gets angry, it just turns red.
Is it raised?
It's not raised, no, it's
Oh,
just
that's
on
just
her
black.
skin, just right here, a little.
Could be a Mongolian spot or a stork mark. What do they call them? Yeah, stork bites.
Yeah, I've seen those too. Those are like the little, like little strawberries. But hers is right here. I was like, man, like if she has that her entire life, it's gonna be like, oh God, she's turning red. The crazy's about to come out.
Something else that I've seen is birthmarks that are lighter in skin color. They get lighter than the skin. That's something that I'm seeing that's becoming more popular and I'm seeing it more, but and I didn't see it so much, and I see it in my children. Like my daughter has this birthmark over her heart, and it's white. It's like somebody took a piece of chalk and wrote right here.
Oh wow.
And as she's getting breasts now, I'm like, wow, that's significant, you know, because it's like now it's pretty big. It's about, it goes like here to here, and it's like about the size of a piece of chalk. And my other daughters have like up from their navel these little white light spots up from their navel. All of the other two. It is really cool, and I'm, not sure. I haven't seen a lot of reference to it in newborn exams. Usually you see a darker variation, a red mark or something like that.
Did they have it at birth?
They did.
Which one was she the one that got tased?
No. The one that got tased has them coming up from her navel.
That's crazy.
But my baby daughter has the same ones coming up from her navel. So.
That's kind of crazy. And then they both have it too. That's cool.
The other daughter, like, see, your light is shining out from inward. It's coming out. See, it's good. Yeah, you went. So some things that you could do to assess a baby. Some of the things that you want to be aware of is hydration, right? And it's really easy to assess hydration in a baby because the skin, just like our skin, there's this turgor that happens. It's like elasticity, this fullness that you can like pull your skin and it not get that wrinkly stuck in a wrinkle. It'll snap right back. That's a really good way, non-invasively, to assess a baby. Because you know your baby is hydrated well if they have good skin tone. That turgor is really important. Another way is to assess hydration is the soft spot, the diaphragm. It usually will be dome-shaped, full of fluid if a baby is well hydrated. That's something good for parents to know too, especially when they're having concerns about is the baby getting enough milk and stuff like that. You can say, well, this is a way for you to assess. If the baby was becoming dehydrated, these are some signs of that. First, the skin will be more leathery and more wrinkly, won't be as full like how our skin is, and then you'll see a dipping, and sometimes if it's severe dehydration, a diminishing of that fluid, a dramatic diminishing of that fluid that's visible because you can see it concaving in there instead of this nice roundness. That's normal. If you have the way to visibly assessing is better than putting your finger on it because it will give to your finger really easily. So for babies with more hair, using these other signs would be better.
And so in the hands, what are we looking for again?
Just see this consistency in your skin and how it's full, and when you pull it, it doesn't wrinkle, it goes right back into its normal spot.
Right.
Well, if you were dehydrated, you wouldn't have that kind of return. You would have a delay in that return. And if it's severe dehydration, you would really be able to see a marked wrinkle from where you had the skin.
Is that called tenting? Tenting? Like tent?
Oh, never
Is
heard
that
it called
something else?
tinting.
No? Okay. Maybe I just made
Makes-
I don't know, I feel like I've heard that before.
I haven't heard tinting, but I don't know everything and haven't heard everything either. Usually a newborn head is about the fourth the size of the body, and you may see evidence of molding. And I've seen really different variations of molding, from extremely severe molding, what I would consider severe, where you see an imprint in the actual skin, and no molding in some cases. My breech baby didn't have any molding at all. It's pretty cool. Her hair was perfectly real. Sweet. Never seen that. So the head is made up of actually 5 bones. You all know 2 fontanelles and 2 fontanelles. 5 bones and 2 fontanelles. Sometimes you'll have a capit on a baby's head, and I usually see capits from a prolonged second stage of labor, when the baby is descending through the pelvis. And I've only seen a capit in my clients that have had really extended second stages of labor. Like, because I don't encourage moms to push, we usually will just labor the baby down, and that sometimes takes longer than if you were actively moving the baby through the birth canal. And so in that molding is more, I see more molding. And I see less tissue damage though, which is good, It kind of goes to say that, to me, should show me that this molding is necessary for the process. So I really encourage moms to not push and allow the baby to mold as much as they can to prevent tissue damage, especially with a first-time mom. First-time moms, really, honestly, I think the most important tool as a midwife supporting first-time mom is tincture of time in second stage, because baby really needs to mold a lot, and a lot of times that process doesn't happen. And I see that being a lot more management of the actual birth of the baby, crowning and so forth, and also a lot of times it results in repairing damaged perineal tissue because the baby didn't mold really well and the birth canal hasn't been navigated before. Moms don't really have an awareness. A lot of first-time moms really don't have an awareness of how to manage the birth of the head of the baby, And so sometimes you'll have a lot of expulsive pushing with the first-time mom as the head is crowning, and I don't feel like that's the best scenario for crowning the head. Obviously, however a baby chooses. What Michelle O'Donnell says, the fetal ejection reflexes happens, and in that, if it happens, then it protects your bottom, and he sees less tears and tissue damage with clients that experience that fetal ejection reflex. And expulsive pushing is not the fetal ejection reflex. It's not. Pushing the baby out is not the fetal ejection reflex. The fetal ejection reflex is like instinct. It's like this thing that your body does. That kind of like, I don't know, for me, when I was having my last daughter, I was in the pool, I could actually see it in the video. I could see that happen, and I knew that, and I knew what was happening in the video, and I was like, that was a fetal ejection reflex. It was the first time that I actually saw it in somebody that I was observing, looking to see if it was happening. And I was in the tub, and I was like, ugh, like I went almost under the water in just an instant. And her head was out, and that was it. And then the rest of her body was formed. But you could see that reaction that happened, really clearly. I think it was pretty cool to see. A capit, which is what we were talking, is swelling on the scalp, on the baby's scalp. And usually a capit will be on one side or the other, on top of, sometimes I'll see like a cone head type of capit, you know. Now, caput is just swelling. It's not like the cephalhematoma, which is fluid under that, blood or some kind of fluid. We're just talking about swelling. And sometimes I'll see, like, you know, the cone head old TV show. I see a lot of that. I see a lot of babies that look like the cone head children. And I like that. I like cone head babies because that means violence is not, you know, if my baby molded really well, I can almost know for sure that there's minimal damage to mommy's bottom. I don't have to have that, you know, awareness most often, you know. And so I like to see molding. I think that the reason that the head is made the way it is so that we could protect our tissue. And so I think that we don't see as much molding as could be possible because we rush that second stage of labor. But I think that it's very important, and I think that that tincture of time will save you time in the long run, because if you're not doing tissue repair and, you know, managing a tear or repairing a tear or sits bathing because of a tear or nourishing because of a tear or honeying because of a tear because you allowed more time for molding, that's time served, don't you think? I think so. So I try to allow baby to take its own process, and in that I see minimal repair stuff, and I like that. A cephalhematoma is blood between the bones and the periosteum. So that is actually fluid on the head. And a cephalhematoma is going to have the margins of the suture line usually. So you'll see it on one side of the head, on this side, or on this side, or up in the front, or in the back. I have never seen a cephalhematoma in a baby during birth. I have seen one in a child, and it's really a different thing from a caput, and it's clear that it's different from a caput. You can like depress it, and it's definitely fluid in that. And I saw that in my little sister when she was 9 years old, and that's the only time that I've seen a cephalhematoma. Usually, if there's a cephalhematoma present, most of the midwives that I have talked to that are inclined to use homeopathics resolve it with arnica. And it usually resolves pretty efficiently with arnica because it's usually from some kind of bruising that's happening. Bruising causing blood capillaries to break and bleeding to develop under those. The periosteum and between the bone. We talked about the color of jaundice, but eye color just varies with children. And honestly, they say several months it takes for a baby's eye color to normalize, but I've seen much longer periods of time. I've seen more like 2 and 3 years it taking for a baby to have a permanent eye color. So, and that's like the color of the pupil, not the whites of the eye.
I think I missed that. What did you say? You look at the eye, but what are you looking for? Just
I said we were talking about eye.
okay.
I was saying we talked about jaundice, and then I said the color of a baby's eye. Usually they say that it will shift and change for the first couple months of life, 3 to 4 months of life. But I've seen in my practice and with other people a much longer transitional time with the pupil color, the color of the actual pupil. So for example, I had a little boy, Sultan. He was born with like extremely white-gray pupils, like a little like this almost, really.
Wow.
And this was the African American baby, which was really odd for him to look that way. It's really amazing too. Like the cutest little.
Did it ever change?
It got a little darker. It's a much darker gray, but it still has a very translucentness to it.
Does
But
he
it's
have
gray.
any eye problems at all? No? Wow.
Very
Love to see
cool.
those eyes.
I think I have some pictures I could pull up for you.
That would be cool, because I'm like trying to picture it, but
Yeah. And it was really shocker because the family had brown eyes, dark brown eyes. Nobody in the family has these light eyes except him. Yeah, that was my baby that was born on Ramadan, remember? So things that cause problems like conjunctivitis are bacteria in the eyes. Staph, chlamydia, gonorrhea can cause conjunctivitis. Eye drops are usually used to treat it. For me, in my early practice, it was important for me to have eye drops in my supplies. Just because, just as a precautionary, and I'm just assuming that everybody is not being honest with me and, just as a precautionary. Now, it expired and it was expensive and I didn't buy it again because I never used it. So, it could be useful, especially in the demographic that you work. It could be something important to have in your bag.
And you gave that for if someone had.
If I saw problems developing in the eye that didn't resolve with breast milk, then I would use that.
And what's your kind of routine with working with breast milk for the eyes? Like how often would...
If there was a problem, if we were dealing with conjunctivitis, and it was because mother had something, and obviously if you had a baby that had oozing from the eyes, you'd want to inquire about, are you having unusual discharge? Obviously you would know that if you have a relationship with this family. But if you didn't, I would be inquiring, like, what's your body flora like? What is your vaginal discharge like? Maybe we should address that, What is causing the baby to have the irritation? If it's nothing, breastfeeding usually is pretty efficient if you use it frequently. So I would say after every single feeding, I would put milk in the baby's eye. And that's minimal if we were using it to treat conjunctivitis. I haven't really seen intermittent use of breastfeeding work. I know people who say breastfeeding works for conjunctivitis, but they usually aren't committed to that schedule, and it usually takes a lot longer for it to resolve. If you're committed to doing it frequently, you can resolve it in a day or two. Breastfeeding is really powerful in that way.
Milk.
Breast milk, yes, breast milk.
And I know some Amish women, they use raw cow's milk. They're like dairy farmers, so in their older children, if they're not breastfeeding or if they won't allow breast milk in their eye because they're too old or something, they'll use cow's milk, raw cow's milk, and it works too.
Okay.
So if she wasn't breastfeeding or whatever.
Yeah, that's an option. Definitely. I prefer breast milk though.
That doesn't happen to cow.
You gotta find raw cow's milk,
Yeah.
which is illegal in a lot of states. In South Carolina, it was really funny. They had that's what they can do. They can do a association to be able to get the milk. I know this guy who this is totally off subject, but I'm going to just go off subject for a minute. Maybe we just needed to divert our attention. So I know this guy who does this delivery thing in South Carolina where they have this meetup that's at the farmer's market and they exchange milk. People order milk and he brings it. It's illegal because it's traveling with this milk across state lines, which is illegal. And they have had he showed me a video and it was like them like raiding the farmer's market and like taking all of their milk and just like dumping in it. And the people were all standing around like, we paid for that. And they're like dumping like 200 gallons of raw milk.
It's just messed up.
And I was just like, whoa, really? And they're just like, it's illegal. And you want to go to jail or you let us dump it?
It's funny to think that people buy raw milk on the black market.
They do.
They totally
Well, they sell it at the farmer's market over there, but they have a sticker that says not for human consumption.
They'll say, that sticker is there. Yeah.
They're so bad at this.
Yeah. I'm like, oh, I love milk. I probably would have go crazy because I have an addiction to milk. I would have rioted.
really upset because I mean, this was like the supply for all these families. They would get this milk supply every 2 weeks, and like it was so many families that were waiting for this milk, and they were dumping it all.
That's a perfect solution for them. They're
That's
already
the
connected.
perfect solution for them. I am about to make this association.
When
better
I was
watch out.
also illegal, and there was people that were doing like a cow share
Uh-huh.
thing, like similar to CSA, like you pay, you're a part owner of this cow, so we're just bringing you what's yours as long as you're paying your cow's monthly fees or whatever it is. So
That's
you know,
cool.
there's a few different ways around it. Yeah.
They just made some law in Louisiana, like, it was just like maybe 2 months ago, and it's actually good. It says that that you can sell raw milk, but not at like grocery stores or anything, but they're saying that you can sell it.
Oh, that's good.
Yeah, I was so
People
excited.
can go there and
Yeah. You got a hookup now, Kim?
No. I don't know exactly when it takes effect, but it was like this really big thing for me. I was like, raw milk, I can't wait. Where will I get it? I know, I love it. I love it. I have a milk addiction, so of course I love milk. Chocolate milk, strawberry milk. I'm gonna own a cow one day, I guess.
yeah. My kids want to own a cow too. They love milk, and they're like, my brother's coming to visit, and he's a vegan. I'm like, I don't know what we're gonna do. He's like, us stop about eating our stuff. And I'm just like, I don't either.
Yeah, right.
He's one of the really opinionated vegans.
Yeah.
Yeah, this is gonna be funny. So the other thing that looks like conjunctivitis, which is really a bacterial infection in the eye, is a clogged tear duct. And that can be problematic. And so you need to kind of deduce whether this is conjunctivitis or if it's a clogged tear duct. If it's a clogged tear duct, those can easily be resolved with warm compresses and just massaging the duct to let out. And just, you would massage it a couple of times. It usually takes a couple of times for me after I put a warm compress on the eye in order for the duct to clear. And it will usually clear. And it'll be like some gook that comes out and then it clears.
So you just go from over here down
To the corner. Just massage it. You might do it 2 or 3 times. And it's usually really gentle. They usually won't even, act like it knows its house. It knows its way.
Does something come out of it?
It does a lot of times.
Like it'll be
Like, it'll look like, I've seen like a goopy, thick mucus.
okay.
Not a lot of mucus, but you do see a little, you want to clear it. So whatever's blocking it, you want to move it through. And so you will see something.
And
That's
how
a
do you
good
do that
sign.
again? You just
From the inside out, because the duct is that little hole
Right.
right there. So you got to massage in the eye to the duct.
yeah. I can
Now, obviously, you want to make sure that whatever's clogging it is not hard and stuck.
Right.
So that's why I do the warm compress first to soften any crustiness on the eye that allow that whatever is blocking the duct, whatever that mucus is, to pass, to come out. And then, once I do that, because I have had my hand near the eye, I'm going to use breast milk for a couple of treatments after that, just to prevent any irritation from what we just did.
How can you tell the difference? I mean, I think about it, I've had clients be like, yeah, it's like, the baby's got crusties and stuff, and so how will we tell the difference?
Usually an infection is oozy, and a lot of times you'll see like the eye crust close. You may see redness in the eyeball, on the whites of the eye. You see much more of a sign of irritation.
Right.
As with a clogged duct, you just see some crustiness like in the corners of the eye. That look unusual. That just keeps coming back. You'll see some more and more crustiness. But you won't see a lot of oozing like you would if it was actually conjunctivitis. And then you wouldn't see irritation in the actual whites of the eyes like you would in conjunctivitis. Clogged tear ducts, we have to differentiate to make sure it's not an infection. And then you have subconjunctival hemorrhage. Now, that's just that little blood spot that you see on a baby's eye. Really, really common. Like, I see it really commonly, and most of my clients aren't pushing, so I can't say it's related to pushing. It's just a product of being born, and usually it's no problems. It's no sign of a problem, and I usually resolve it depending on the needs of the parent. So if the parents are like, oh, I really don't like that, then I'll say, well, let's give the baby a dose of arnica. We'll crush down an arnica pellet, and that will usually resolve it. If a parent is not inclined to do anything, then I'll let it resolve on its own, and it will over time. Usually babies do not produce tears for the first month, so don't expect to see tears when a baby is crying. You just don't see it. High contrast as far as vision, and the perfect distance for a baby to see is the distance from where your breast is to your face. That's kind of the distance that is a good range for babies, and they like contrasting colors. I normally see baby very active with vision after that first hour. After that first hour, the baby is really observing its world and does that for a while, and then will nurse and go to sleep for hours and hours. And I guess we should talk about that a little, because I've noticed a recovery period after the baby is born. And sometimes parents are alarmed because they have this thing in their mind about waking the baby to feed them. And sometimes a baby will sleep for 7 or 9 hours. Even I've seen a baby sleep for 12 hours after the initial breastfeeding and all that, and be put down and just be out. And mom is like, baby's been sleeping, baby's been sleeping. And I'll tell her things to look for that shows that the baby is normal, breathing is normal. You see in the chest rise and fall, you see the baby is still well flexed and things like that, and the color is still good. But I really honestly believe that the baby is in a recovery period. Just like we have a return in our bodies from this experience, I think babies also have that process of acclimating that happens. And so I try to encourage families to allow the baby to have that, at least that first initial rest down. And most of my families will honor it. Only time that it doesn't really get honored is when grandparents are there that are used to the schedule of feeding every 3 hours. Mm-hmm. And that I would explain to the parents that this is the baby's recovery period. It's completely normal for the baby to sleep excess of 5 hours, and it's okay to not feed them because baby is protected with its brown fat. It's really important for people to know that babies do not absolutely have to eat in the hours after they're born. Because breast milk is not a calorie-rich milk in that point of their life. It's really just about building the immunity. Babies aren't really getting nourished from breast milk. They're getting nourished from their body stores that happen over the course of that last term of their pregnancy. And so you can be okay, you can relax a little if the baby sleeps for a while, And probably if the baby sleeps for a while, when he wakes, he's going to be a really interested nurser, really interested in nursing. And so be prepared for that, but absolutely allow baby to have that recovery period. Obviously being in watchful observance that everything is normal. Squinting is normal for babies. Usually taste buds are developed prior to the birth of the baby. Babies can differentiate sweet and bitter tastes. So I've had midwifery friends say that they couldn't encourage the baby to nurse, so they put something sweet on the mother's nipple, and the baby was interested in nursing after that. I've never done that, but I could see that it could be relevant. if it is relevant. I mean, because babies are interested in sweet. They can differentiate sweet and bitter, and breast milk has a sweetness to it. My kids say it tastes like sweet coconut milk. So they're gauged for coconut milk that's good. Does it taste like breast milk, or does it taste like a real coconut? Have you noticed that? I mean, do you remember what breast milk tastes like?
I
It tastes the
mean,
same. Emily as last time. It was light like coconut milk. Like I don't know. It was almost too light to be coconut milk because coconut milk's thicker usually. But it reminded me of like a lighter, sweeter almond milk, like a vanilla almond milk.
Like rice milk, I think sometimes.
I never drank mine. I mean, the father of my children did, but I didn't drink my breast milk. I don't know.
Breast milk to me tastes, my baby daughter who nursed forever, you know, when she stopped nursing, she was like, oh, it's a coconut milk, it tastes like breast milk. And that's kind of like the range, the gauge. We know which coconut milks have breast milk taste, which don't.
Oh, that's your way of judging how good a coconut. So what's a good breast milky coconut milk brand?
What's a good breast milky brand?
Well, what are you saying? Well, like, because you're
Well-
saying that's the gauge of goodness of the coconut.
Well, no. The coconut milk, for my kids, we're used to like tipped off coconuts, like the kind where you just cut the coconut and drink the milk. That doesn't taste like breast milk. It tastes like sweet coconut water.
Yeah.
That's what they're looking for. If they taste something else, it's the breast milk kind.
Okay.
You know, they're like, oh no, that's the breast milk kind. So it's a lot of different brands that we like, but some of the cheaper ones that you find at the regular, like Ingles and those brands that they carry, they don't drink them at all. They have cases of it in the refrigerator. They won't drink it. But if I bring like some of those Thai coconuts, they will be gone in the day. A whole 12 dozen of Thai coconuts, gone in a day. They want them cut, they will drink them, then they gotta get them split so they can get the jelly out. This is all process. They love coconuts. Me too. That's their dad. Their dad did that for us. So a cleft palate. Obviously you want to check for things like a cleft palate. And indicators, there are visible indicators of cleft palate. Noticing variations in how the mouth is, like wrinkling in the lip, you know, just differences in how the mouth looks from what you consider to be normal. If I saw that, I would be inquiring. I would inquire earlier than my newborn check, because my newborn exam, the full exam that I do, usually happens about an hour after the birth. But if I saw something that would make me think that we were having an issue with the palate during the process of a return, then I would inquire. I would want to check. And how you check is by putting a clean, I don't use glove, but if you are inclined to use glove, I would use a clean finger in the baby's mouth, checking the top and the bottom of the palate. And it should be complete. If it's not complete, that's a cleft palate. And that's a birth defect that can be corrected very easily. And there's ranges to it just being visible, I mean, where you can feel it on the inside, to it being completely visible on the outside and affecting how the face looks. And in that instance, you will be able to see it right away. I have never had a cleft palate with any of my.
And I mean, what would it feel like? What would I feel? Like,
You would feel a space.
it wouldn't be
It wouldn't be
round.
complete.
Uh-huh.
And it may not be complete on one side, in the middle. You'd have to sweep the whole top palate and bottom palate to make sure that it's complete, you know. Usually the top palate is where you see most of the clefts happen, but it's really easy. You would be able to feel it, because if you take your tongue and run it across the roof of your mouth, you can feel that it's one complete bone, right? And in a cleft palate, you would feel some variations in that, and depending on the range and the intensity of it. You know, sometimes it's just small and not needing to be repaired, and sometimes it needs to really have a repair done for it. That's important for you to know and to inform family about, because it's going to affect breastfeeding. You know, so.
And how soon would you want to take the baby in to have that repaired?
I would be consulting with my physician, with my pediatrician at that point.
Yeah.
You know, because we're thinking about genetic abnormality, so we're thinking, is this the only thing that we need to be aware of? So I would do more of an observation period for this baby. But then I wouldn't consider this to be an emergency transport though, because it's relative to food feeding, right? And because the baby is not in a critical need to eat, I would think that for me in my practice, and I guess it varies and a lot to do with how receptive the parents are, you know. But I think that I would be more inclined to have that experience be done by a family pediatrician, you know, rather than going into the emergency room and having it done that way. So I would make arrangements for a baby to be seen by the pediatrician that the family chooses sooner than, usually my clients will see the pediatrician within 7 days. And so I would say sooner than that, like within the first day or two, you know? And in that, if your baby has a cleft palate, they still can eat. They just can't latch. The latch is a problem. So if you were able to express milk, obviously you wouldn't be able to express that much milk on the first day or 2 days of life. But if that option was you, if you were yours, if you were a tandem nurser or something like that, you'd be able to do like a dropper feeding until that process happens with the baby. And that's usually how nourishment is given to the baby. Some kind of assisted feeding, you know, is done until the surgery happens and the correction happens and the healing process is over. Thrush. I usually do not see thrush in a newborn. You know, usually thrush develops after breastfeeding is established. And most often I see it in families that are really inclined to use breast pads, honestly. And for me, that's where how I experienced it, how it came into my life. And that went from regular thrush to breast thrush, which is a nightmare for a breastfeeding mom, you know. And when I revisited those weeks after the baby was born, the thing that was most prominent was breast pads. Because with my daughter that was born at that time, Akita, I was tandem nursing my older daughter at the same time. So I had good milk when my newborn was born. And so my engorgement started that first day, I feel like. And by the second day, I was like living in my breast pads, you know? And I think that is why she got thrush and then I got breast thrush. And we recovered from it. It's a hard thing to recover from. For breastfeeding, I've heard people describe it as a lot of things, but it felt like needles sticking into my breast.
Shards of glass.
Yeah, shards of glass, needles that permanently lived there, and as soon as they latched, they just got stimulated. Yeah, it was the worst thing that you can imagine with breastfeeding. And it's one of those things that you gotta like work through, because you can't like not breastfeed because your milk supply reduces. No, you gotta work through it. And it's Phytolacca is a homeopathic that I used when I had breast thrush. Phytolacca, and it worked for me. I've had other people use gentian violet to paint the baby's mouth or to paint their nipple. That works. It really works. If you could get gentian violet and put it in your supplies for the postpartum, I would say do it, because you can't always get it. You gotta kind of get it from one of those old school pharmacies, because they don't have it at like CVS and Walgreens, that you won't be able to find. But if you go to like B&B Pharmacy on Hayward Road, one of those older pharmacies, they will definitely have it. And it's in the section with like Epsom salts and all those little, how that section has all those old remedies like spirits and all that stuff that they used to use back in the day. I'm sure people still use it because they still carry them. but I don't see that being,
What
in
was
my
it called
reality.
again?
Gentian violet. And it's the extract of gentian plant. And it's purple. That's the thing. It's purple. It's like bright, vibrant purple. And so I've had one client prenatally have a really aggressive yeast infection from wearing some kind of crazy underwear that her partner got her. And, and it was like external. It wasn't an internal yeast infection, it was external. And we couldn't, all of the traditional treatments for a yeast infection are like internal applications, And it wasn't that. We didn't have that happening. We had an external yeast. And we used gentian violet, and we painted her whole bottom with gentian violet. It was quite an experience.
Also
Of
for
art.
her partner.
Yes.
Undies.
Purple undies. And the only thing, the complaint that she had was that they had ended up having to change their toilet seat after this experience because it was purple stained.
Did
But
you
it
guys
worked.
ever use like vinegar? Have you ever heard using white vinegar for
Yeast?
yeast?
No, I have never used white vinegar. Have you seen it be effective?
No, I mean, we tried it. My daughter got thrush and we tried it in her mouth, and I tried like a probiotic paste. You like smeared in her mouth, and none of it worked.
Would work for you.
Nystatin.
Well, that will definitely work.
Yeah.
Gentian violet will work though, if you can get it.
And so you would just like take a Q-tip and paint it inside the baby's mouth or
Yeah.
something? And it's
And they'll have purple lips, purple mouth, all of the mucus, all purple.
breast will be purple.
Of course you're gonna paint your breast because the baby's mouth is going in contact with your breast.
Right.
So it's important that thrush doesn't go from oral thrush to breast thrush, which is a whole nother
Do
level.
you know what it tastes like?
From what I understand, it doesn't really have a taste.
Okay.
I haven't noticed babies react strongly to it. And I've seen it used more than once.
Yeah.
Something else that a friend used that was really effective, one of my clients, is alkaline water rinsing. And she treated her baby's thrush with that. Just rinsing the baby's mouth out with alkaline water regularly. And we treated it. And so that's a really gentle way of doing that.
I just seen alkaline water for the first time yesterday.
Yeah.
I've never, I don't know, like bottles of water, in the store. And I don't know where I was yesterday, but I was at some store and I walked past it and it was like,
8.8 or 9.5.
yeah, it was like alkaline water. I was like, that is interesting.
Yeah.
You can get these little tubes
never
I've
seen
seen.
that.
You can put them in your water and it alkalizes it, or there's like the Kangen machines that you can program how. Yeah.
And pretty much nowadays you can find alkaline water everywhere because it's really popular. And my favorites are not machine-produced alkaline waters. And it's some brands that you can find that are naturally occurring alkaline.
What is the benefit of having like alkaline water?
Well, alkalinity in the body, having a higher pH, is really how your body is striving. Your body is striving to be kind of like 8. 8.8 is kind of what this new alkaline movement is pushing. But because in order for an illness to occur in the body, there has to be a certain level of acid. And most of our diets, especially if you eat conventionally, most of our diets produce acid in the body. And we have very few things that alkaline the body. There are some really powerful alkaliners like avocados, broccoli, kale, are really powerful alkaliners. And like your dark fruits like blueberries, raspberries, blackberries, plums. And some people don't think plums are naturally occurring, so they wouldn't fit into the alkaline, just depending on what school you come from. Generally, living foods are more alkaline. So having fresh fruits and vegetables in your diet is really important because the more alkaline your body is, the less susceptible your body is to illness, really. So if you were, for example, if somebody had cancer, they would have their body would be much more acidic than alkaline. In order for the cancer to develop, you would have to have an acidic nature. And so the whole idea behind the alkaline movement is moving towards making our body less acidic like it is in our modern society to be more normally balanced or more inclined to be alkaline. So either you're balanced or you're more inclined to be alkaline rather than what we are now, which is more inclined to be acidic because of the foods that we eat. Cooked foods reduces alkalinity, reduces the pH. So anytime you cook something, you're reducing the alkalinity in it. So it could be really relevant. It's relevant for me in my prenatal care, and that's why I love the pee sticks and being able to check people's urine pH, because I like your body pH to be higher. And usually when I see a lower pH is because people are eating a lot of processed foods. That's usually a good indicator for me that we need to do some dietary counseling. And we talk about things to up our pH. And usually I like to see about 8. And I very rarely see 8 when I start out this process with a family. I see it closer to 5, And by the time we get through working with each other, I see it closer to more like an 8, which is really good. It means that we've done some good work. And then having an awareness about alkalinity and its effect on the body is long lasting. Once you take those steps to think about, okay, is this food more acid or alkaline, then you just start to shop that way. You start to shop being conscious of how this food is affecting your pH. Kind of twofold. It goes to long-term health and immediate health. And so because the pH of the yeast, in order for yeast to thrive, it has to be in a low pH environment. So alkaline water, introducing into that environment, ups the pH of that environment, which will reduce the growth of yeast. And in that situation with Rajani and her daughter, resolved the issue that they were dealing with. I don't have a lot of experience with alkaline water being used other than that one instance, but it does, give you an opportunity to see if it works, experiment with it and see if it works. It was much more gentle than painting somebody's mouth with ginseng and violet. The process is just wrenching on that. It's really easy. Where are we? Tongue-tied babies. I don't have a lot of experience with cutting ties. I'm nervous actually about the possibility of that being necessary. And it's because of an experience that I have with one of my clients, my Sultan. The pediatrician that we chose for Sultan was not our normal pediatrician because she was out of the country, but it was another sister who had a lot of reviews and raves in the home birthing community, supported home birth, and was a breastfeeding advocate. So I was really excited to find her and work with her. And my first client went to her and for their newborn exam, and she assessed the baby with a tied tongue, and she did the procedure in the office. And the problem with that is it's a home birth baby that didn't have vitamin K injection, which means that my baby didn't have clotting factor.
So this was like within a couple of days of birth?
This was within a couple of days. It was like 4 days. And it was really traumatic. They couldn't stop him from bleeding. He had to be admitted into the hospital. He had to be taken to the emergency room to get vitamin K injection. And so that's relevant to know in the home birth practice, that if you are going to do things like cutting a tied tongue, that you have to know that your baby has been eating well and it has those factors, or you are prepared to deal with the repercussions of not being able to clot, your blood not being able to clot. Having vitamin K, ampules or injectables or something would be part of my supplies if my protocols called for that procedure to be done. So if I did that regularly in my practice, I would have that support network for myself of having the ampules of vitamin K available for the baby. Ampules, they're like a little single serve dose of liquid.
Like those tiny Pitocins that you have, you know?
Yeah.
So this would go for like circumcision too.
This would go for circumcision too. Anything where bleeding or the baby is being cut. What I do for my, go ahead.
Yeah, I have just a quick question about vitamin K. Like, say someone didn't give it because it was a home birth, but I was thinking that too, like circumcision. When they were waiting, the 8 days or the 14 days for circumcision, can you give vitamin K later if you don't do it at birth and like do an oral dose or a one-time dose or something like that?
If you felt like it
before
was
that?
necessary.
If someone
could.
wanted to,
Yes.
you could. Okay.
But it's easy to, I feel like for me, in my practice, what I do is supplement vitamin K. From 36 weeks on, my clients are taking alfalfa capsules, 6 a day until they deliver. That will build their vitamin K reserve and also build the baby's vitamin K reserve. You cannot do alfalfa tea though, because vitamin K is not water soluble. It's like vitamin A. It's, it
Are
has.
they taking tinctures then?
No, they're taking capsules
Okay.
of the raw plant.
Okay.
You said it can't
And
be
that's
the
at
tea.
36
Can't be the
weeks.
tea. No, 36 weeks, yes. 6, and I do 6 tabs or capsules a day. And so that's 3 in the morning, 3 in the afternoon, 3 in the evening.
My preceptor just told me yesterday that she has a couple of women that have a history of postpartum hemorrhage, and she started supplementing them with vitamin K tincture, which I've never heard of. And she says it's kind of giving her some success,
Okay.
which is interesting. I hadn't heard that before.
I've never heard of the tincture, but it would be, I think it would be just as effective because the vitamin K can break down an alcohol menstruum, and so it could be really useful to get it in the tincture. They probably are giving an herbal.
Maybe it's like alfalfa.
Yeah, because alfalfa
tincture.
is one of those herbs in our repertoire that have the most concentration of vitamin K.
Yeah, I'll ask her
Yeah.
what it is.
I just have a question, because I felt that when we was talking about the teas, you know how you do teas? Like, I really love that. I'm totally gonna do that. I just love that idea. And then we said like at 38 weeks, didn't we add alfalfa to the tea blend?
We didn't add it to the tea blend, but we added it to our regimen.
Oh, okay.
So let me correct that. It's not in the tea form. Now, mind you, you can have alfalfa in your tea because it is the father of all. Alfalfa is a super rich because of its deep roots, and it's a huge mineral-rich plant. So it can be useful in a tea, absolutely, to build your iron. It's very effective. It's really effective in early pregnancy for nausea, and in generally for keeping your mineral levels and vitamin levels up if you're not doing a vitamin supplement. Alfalfa can be really useful. But vitamin K transference is not going to happen in a tea because vitamin K is not water soluble.
Okay. When you recommended alfalfa in the tea for, if there's after engorgement, is that in the tea or in the?
Yes, that's in the tea because alfalfa in the tea will stimulate breast milk production. Remember we talked about breast milk production? And that's what it's really useful for in the tea. And again, it's nutrient rich, so it's almost a given that it's going to do things like produce more milk. But it does have a real affinity for milk production outside of it being just nutrient rich.
Do most of your women take the alfalfa capsules then?
Yes,
You recommend it to everyone and then most of them take it?
yes, yes. Yeah. I don't think I've had a client that didn't do the alfalfa. And my Sultan's mother did the alfalfa. And still something like cutting a tongue tie, which is, has a lot of blood flow to that area of the mouth. You got to consider maybe an herbal supplement is not enough for something like that, where you might have serious blood flow. Like, for example, if I was going to take blood from my baby's arm, like he was going to have a surgery for a cleft palate or anything like that, I wouldn't depend on alfalfa for that. I would want to have an ampule of vitamin K oral that I have in my kit as a security for my baby if he was going to have any kind of procedures prior to 14 days. My babies that are the circumcisions after 14 days never have bleeding issues. Because once your full milk starts to come in, your body starts to produce vitamin K as a product of digestion. And so your baby is going to get vitamin K in his system. We'll definitely get it. It just isn't going to happen right away. It'll happen after some days of eating.
Well, I'm sorry, I know we're moving on, but, so we're giving it 36 weeks, and then when can they stop? Like after the baby's born?
I stop when you go into labor.
Okay.
Because again, if you continue to do alfalfa, it's going to increase your milk supply.
Okay, right.
You're going to consider engorgement is coming unless you have a need to increase your milk supply. If a mama had a problem with a low supply with other children, I would say continue her on the alfalfa. But if in a normal circumstance, alfalfa would create a huge amount of milk. Not normal, huge amount of milk. And that can be really hard. Engorged breasts aren't the easiest things to deal with. Because you just can't get comfortable in any position. Yeah, even like the weight of just leaning is a big deal. If you're leaning back, is your breast leaning to the side? That's a big deal if it's engorged.
Like they make that joke, boulder holder.
Oh yeah,
But
the
it,
over the
like,
shoulder boulder.
Feels like a boulder for real. It does, like your poor thin skin is just trying to hold up this rock.
Yeah.
Good old Rocky Top.
Add that to the list of things to never say So I've been hearing that people are talking about tongue tie being more common. Have you experienced that in your practice?
I have never had I've never diagnosed a tongue tie. And honestly, I didn't diagnose Sultan's tongue tie either. I didn't feel like he needed it. She did. She has more experience with breastfeeding families and she probably sees more problems around breastfeeding too. So I don't know. Did he have some challenges with breastfeeding? His latch was funny in the beginning, but by the time they got to the pediatrician, he was nursing normally. Do I feel like he absolutely had to have the cleft palate? The tongue untied? Well, when you look at the bigger scope of everything that happened, no, absolutely not. But, it happened. Yeah. Like if I had foresight and thought that she was going to consider doing something like that, because I never even thought that it would be a consideration. And it wasn't even part of her diagnosis until the mother said, well, I had some problems. She was talking about breastfeeding. She said she had some early latch issues. And then she was like, oh, maybe he has a cleft palate. Oh, yeah, it is kind of tight. Just cut it. This could be, and when people say things like, oh, it was easy as pie, type just once, it's not the truth. It's not just one. You said you've seen a cleft palate done, and is it just
tongue tie?
A tongue tie.
Yeah.
Is it just that simple?
Once we got there, the baby was not 3 days old. He was a couple of weeks old.
Okay.
And a very experienced
Mother.
Amish mother. She's her fifth baby or something, and she said there was difficulties with nursing. But like, I had to like almost sit on the baby's head to keep him still. Like, the midwife was like, do not let his head move, you know, so I'm like, oh my God. So I had to like really hold him, he didn't want it, we had to wait. I mean, once she got it, it was just like that, but I don't know. She doesn't want to do a lot.
Did he bleed any? Or was
A
it
couple
minimal?
little drops.
Okay,
Mhm.
yeah.
Yeah, and then he nursed and it was over.
Okay.
But he was
He was
a
a
few
bigger
weeks
baby.
old.
Yeah,
Mhm.
yeah. And I could see that. I mean, I think a few weeks old is when I would consider doing something like that.
And the mother requested it.
Yeah.
She, you know, she said, it needs to be cut. Can you do it here? And she's like, okay, sure. But my question is like, so people have been saying that tongue tie is becoming like this thing, this really common like thing that's going on. And they're like speculating that it's the use of folic acid supplementation, which like is supposed to help with midline deformities. And they're wondering if like that is not considered a midline deformity, like a really minor one, you know, that they're taking like this poor substitute for folate, and in high doses, you know, it's like pushed, the general public is pushed to take folic acid supplements, and so they're wondering if it's not kind of like, you know, that thing of like taking too much of something, it causes it. So it's just interesting to think about, I guess.
Yeah, and you know what? I could deduce that because I don't recommend supplementing in that way, but that could be why I'm not seeing it like that, because I just don't usually see that. And if it's a trend that hasn't showed up in my practice, you know.
Interesting.
And so, and I don't really recommend vitamin supplements. I recommend nutritional supplementing, you know. So
Yeah,
it could be.
okay.
Ears. The most important thing with the ears, outside of it being a tool where you can estimate gestational age, is the alignment of the ears and the eyes. So I'm going to read it just how it says here. The top of the ear should be parallel to the inner canthorus of the eye. And if you look at, I think this is Elizabeth, maybe,
Bella.
Bella?
Isabella.
Isabella, okay. You can see the top of the ear is parallel to the corner of the eye. You see that? Usually when you see a variation in that, it's some kind of mental illness that is present. You see that in stem cell disorder, Down syndrome, babies most often have that variation in the eye-ear alignment. And that's something that you will notice as a provider. So that's something that you want to look for.